and that healing is a process of hearing out that dialogue, that inner dialogue, so that we can really develop a relationship with our parts. And what is the we that develops a relationship with the parts? Well, that's self. The part of us that is calm and confident and curious. If the parts of our system can really see our self energy, then they calm down and they relax and they're able to understand it's going to be okay, and that they can be heard and their story can be told.
Welcome to the Mindspace podcast. I'm Joe Flanders. Thanks for tuning in. My guest today is Dr. Robert Grant. Bob is a physician, a professor of medicine at UCSF, and the founder of Healing Realms, a clinic specializing in ketamine-assisted therapy. Bob is especially well known for his application of internal family systems therapy in ketamine treatments. He's a certified IFS therapist and has the great distinction of having guided Dick Schwartz, the creator of IFS, on 2 ketamine journeys. IFS is a fascinating, relatively new approach to psychotherapy that assumes that the human mind is made up of parts, and healing involves the cultivation of harmony among these parts. It's commonly used in the treatment of post-traumatic stress, and is quickly becoming one of the most popular types of therapy out there. I find it to be an especially powerful tool for addressing the root causes of suffering. Many very effective approaches focus more on coping with symptoms, which can also be extremely helpful. But IFS is for those that really want to do a deep dive, which may explain why it's so widely used in psychedelic-assisted therapies. Anyway, my conversation with Bob covered Bob's background in working with HIV patients, the role of parts in the IFS model, the 3 most common types of parts, managers, exiles, and firefighters, how parts become burdened by traumatic experiences, the role of self in healing, and why IFS fits so well with psychedelics. And so without any further delay, I give you Robert Grant. Bob Grant, welcome to the Mindspace podcast.
Hi, Joe. It's great to be here this morning.
Yeah, we've been trying to put this together for a while. Grateful the day has finally come. How's the day for you so far?
It's been lovely here in San Francisco, where I live and work, and we've had some warm days, and summer is coming, and I think it's my favorite time of the year, spring and summer. The days are getting longer. I'm feeling more spaciousness and energy, and yeah,
great.
Going well.
Great. You've got quite an unusual and interesting kind of background, how you came to your work as an IFS therapist, which I want to talk about. So you're a pulmonary medicine physician, you're a professor at UCSF, and you've had some twists and turns. Can you just tell us how you became an IFS therapist?
Well, it's a lifelong story. I feel like I'm just starting to arrive at my original calling. I was studying comparative literature in college, and that took me to Peru, where I immersed myself in literary culture, and I was interested in comparing North American and South American fiction at that time. And I became aware of ceremonies taking place in the northern coast of Peru. People who call themselves curanderos would work with families. And there was one documentary that I saw done by anthropologists that really described a child with a condition called susto, which we might call PTSD. But it's translates to fright. And children with this condition just become withdrawn and less interactive, or sometimes not interactive at all. And this ceremony, it was incredibly powerful. It brought the extended family together, and they did a psychedelic, not using a cactus called San Pedro that has mescaline in it. And then they spent all night saying affirming things to each other and to the child who was affected. And by the next morning, the child was better, and it really spoke to me in a very powerful way. And it was consonant or resonant with my interest in narratives and stories and making fiction real and in magical ways. And magical realism is the connection between North American and South American literature. And so I was just feeling it. I think I misinterpreted it at the time. I dismissed the idea that they were even using a psychedelic medicine at that time. I just saw, a family coming together under the guidance of an elder and saying affirming things to each other. And I said, well, this is a no-brainer. This is why the child got better. It's, what a blessing to be able to bring a family together with the will to make one of their members have some relief and then to say affirming things to each other. That it's social connection is the secret sauce that makes this work. And it ended up being a strong calling to medicine for me, and particularly social medicine and understanding disease as a disturbance in the social relations between people. And I thought I was going to study occupational health and safety or psychiatry, something like that, so that I could study social interactions. But I started medical school in 1982, and what else started in 1982? The HIV epidemic, which I immediately saw was a virus which very directly undermines human connection in so many different ways, through stigma, by making us afraid of sexual connections, sometimes making us afraid of even living together. In the early 1980s, there was enough ambiguity about how HIV was transmitted that some people were afraid to even be in the physical presence of someone living with HIV. Fortunately, we learned pretty quickly that HIV is spread only through very specific sharing of fluids, but can't get it in the air. But we didn't know that in 1981, 1982, when I started working on this. So I just saw this virus as a plague on our human connection, and making us even more afraid of things that we are always afraid of, including vulnerability and connection and sex, and all of these things are scary for us humans because they're so important for us. And so I devoted my life to finding ways to try to solve the HIV epidemic. And that was a 30-year odyssey of developing technology, diagnostics and treatments, and then prevention, including the pre-exposure prophylaxis concept. Did trials proving that it was safe and effective for preventing HIV transmission. And beautifully, I designed those trials of pre-exposure prophylaxis or PrEP to show whether or not taking a pill a day would prevent HIV. That was my goal. But the fringe benefit of that is that people felt safer having sex. And that was the game changer. That is the importance of PrEP, is that for so many men and women around the world who had grown up in the AIDS epidemic era, sex was even more frightening than it normally is. And that created, in some cases, devastating isolation. And people found a way through that by using PrEP, so that at least that, the fear of HIV was no longer a concern for them. And so it was 2014 when I felt like we had all the technology we needed to end HIV transmission and disease. And yet we weren't doing it. We weren't implementing what we knew how to do, either at an individual level or at a public health level. I spent some time in Geneva working with the WHO, and I could see that even at the national or international level, we knew how to end HIV transmission and disease, and yet collectively and individually, we weren't doing it. And so, and then I had a personal tragedy in my life. I had worked with a collaborator, a sociologist, a man named Jeff McConnell, for 12 years. And he was a man living with HIV. And he died that year in 2014. And he died after he stopped taking his antiretroviral medicines that were essential for preserving his life. And, me, the champion of technology development, was devastated, just devastated by his loss, because, if all the technology we had couldn't keep the one man that I cared most about in my life alive, then what was I doing trying to have an impact on the world? I mean, it just seemed like hubris. And so I became very curious about why my friend Jeff, my colleague Jeff, would stop taking his antiretroviral medicines. And I gave up my day job in running a laboratory and doing clinical studies, and took a job as the chief medical officer for the San Francisco AIDS Foundation, which is a huge AIDS service organization in San Francisco. It serves more than 20,000 people a year. And that's when I discovered and learned more about the underlying social and psychological determinants of HIV, the phenomena that impacts all of us, whether we're personally infected with HIV or not. HIV has impacted the zeitgeist of our age. It's in that context that I learned very directly about depression, substance use disorders, PTSD, trauma, and importantly, stigma, and how even in the era of antiretroviral therapy, we still live in a highly stigmatized world. And it's divided into us versus them. And there's HIV stigma, there's racial stigma, there's social class stigma, there's just this natural tendency to divide the world into us versus them. We're okay, they're not. And we still, we can see that sort of inherent capacity that we have to divide the world into us versus them. We see it manifested in all of the isms, the classisms, the racisms, the sexisms, and I think that it really became clear to me that I needed to learn more and become more skilled at human connection and fostering human connection, and that it brought me back to that northern Peruvian coast, and realizing that it was the human connection that was curative or that was essential, and that the mescaline in the room was helpful, maybe because it brought people together, maybe because it facilitated that human connection. But the curative process was human connection. And it was shortly thereafter that I learned about internal family systems, and how internal family systems is very much a story of connection between people, but importantly, how it's also a story about connection within ourselves, where we are home to a whole family of different parts. And they're like external families, in that our internal families live together, and yet they don't always get along with each other. There's feuds and rivalries and differences of opinions, and family members who aren't even talking to each other. And so our internal families are like our external families in that way, and that we are connected, we're living together, and yet we don't always get along. And so internal family systems, from my perspective, gives us a chance to expand the dialogue, the inner dialogue. And as we do that, we become more skilled at externalizing that, and seeing how other people in our lives may trigger different parts of us in a way that gives us opportunities to learn about our inner process as well as their inner processes. So internal family systems is a passion project for me. It's really helped me in my own work. It's helped me reconnect with my career, and I think it very directly facilitates psychedelic healing, and I would go so far as to say that psychedelics really are there to facilitate that inner communication and sometimes an outer communication. But it's the communication and the connection which is ultimately healing. Mm-hmm. So, wow. Very long answer to a short question.
Beautiful. It's lovely to hear IFS kind of introduced in that context. Really, like a beautiful introduction. I wonder if we can drill down a little bit into this idea of parts. I think for many people, therapists and non-therapists, the notion that we don't have kind of like a singular psyche, like one ego or, one singular perspective that we see the world through, can be a little confusing or a little counterintuitive or something. And yet, of course, when you do IFS, it reveals itself to be so intuitive and so real. But what exactly are parts, would you say, and how do they form?
Well, I think the easiest way to directly experience parts of a person's mind is really to think about moments when we may have had difficulty making a decision, or we felt ambivalent about something potentially important. Maybe about a career choice. Do we do this or do we do that? Do we go to this kind of school or that kind of school? Sometimes around relationships, which are very important for us and very complex. We may have times where we debate with ourselves. Is this a good relationship for me? Should I be with this person, or should I, ask for some space, or potentially break up and do something else? And these are moments of ambivalence, and some people, make decisions more readily than others. Thank goodness we're different in that regard. But we all know, we've all had an experience where we felt ambivalently about something, and we've wanted more information, and we've needed time to sleep on it and decide later what to do about a given situation. And that's absolutely healthy if you think about it. If you don't take that time, if you don't pause to reflect, then you end up making decisions in very reactive ways. And so, I think that kind of experience is an opportunity to get to know some parts within each of you, maybe listening, thinking back at a time when you felt ambivalent, or when you struggled with a decision, and then just reflect on what was up for you at the time. It may have been in the context of a relationship, for example, and you may have had parts that very much liked being with a person that you had spent some time with, liked the familiarity, liked some of the things that person did for you and that you could do for them. And then there were maybe other parts that were, I don't know, angry or tired or just curious about something else going on. And so, we have this opportunity to listen to the parts that want to stay in and the other parts that want to get out, and hear them out, and, find out, what are they thinking? What are they feeling? And then possibly even going to another layer, of reflection on, what do they really want, or what are they trying to do, those parts, what are they afraid will happen if they stopped taking that strong position on getting into or out of a relationship, or getting into or out of a job. What are they afraid might happen? And then, that may unveil some more hidden material about trauma or injury that occurred in childhood. So I think that, and I'll become a little more didactic in a moment, but, I think that this is just an opportunity for all of us to have a very, very personal and intuitive experience with different kinds of parts. So in IFS, if you study it, you learn different categories of parts, but you can do IFS without explaining that to your client. And, some clients will need to know what you're getting at and what your paradigm is. And so it's okay to explain it to them, but people can intuit their way through their own parts. So in the example I gave, those, the two parts that were up, the one that just wanted to stay in versus the one that wanted to get out, those are protective parts. They're there to try to keep us on track, try to help us make good decisions, try to keep us informed about things that we might be afraid of or things that we might want in life. So these are called protective parts. And there's two kinds of protective parts. There's managers that try to hold the ego together and try to help us stay organized and somewhat regulated from an emotional point of view. It's the managing parts that other paradigms might call ego. But in IFS, we get to have lots of different egos, lots of different managers. Not all of them have the same strategies or belief systems or experience or knowledge. But managers essentially are like ego. They try to keep us on track, try to have us show up on time and try to help us do the right thing in terms of, staying, being fair and ethical and legal and all that. And then some protective parts are more like firefighters. And I think that, we probably should not call them firefighters, but I'll tell you the history of that, a firefighter is a very courageous person, man, woman, gender non-binary, whatever, but very courageous person. And a firefighter puts out fires. And if the building has to be torn down to put out the fire, the firefighter will do that. And no, they don't like doing that. And it's interesting, yeah, but they are willing to do even violent or potentially destructive things to put out the fire. And so a firefighter is a protector that sometimes is violent or sometimes uses substances to excess and sometimes is self-destructive even. So firefighters, I think we can see them as courageous, but their external behavior sometimes looks very destructive. And but it's helpful in the IFS context to understand what they're trying to do. They're trying to put out the fire. They're trying to calm the system. They're trying to regulate the system, and they just have extreme ways of doing it. So managers are called managers. That's one of the protective parts because they're trying to keep the firefighters contained and well-behaved. I have to tell an anecdote. I did an IFS training with a firefighter, an actual firefighter, wow. A professional firefighter. Uh-huh. And he said that it's really unfair because, firefighters have a pretty self-led agenda. I mean, they're there to save lives, first and foremost, and to prevent fires. So firefighters are actually on almost all days are very self-led. They're very, calm, and they're focused on preventing fire and saving life, human life first and animals second. And it's true. The building is also something that they try to preserve, but that's like a tertiary concern that, And so, but they're not destructive. They don't go out to fight fires so that they can tear down buildings. That's not their goal at all. And so, anyway, this very kind and wise firefighter just kind of set it straight. It's like it's a little unfair. Anyway, so, getting back to the example that I tried to invoke about ambivalence, maybe staying in a relationship, getting out. You've got a manager who wants to stay in, maybe wants to keep the status quo. There's one that really wants to get out, and the one that really wants to get out may be willing to. It may be a manager level. It may be contemplative. It may be debating: is this relationship good or bad for me? But that there could be some firefighters that want out too. And what are they willing to do? They may be willing to have an affair or to do something violent or to, just abandon the situation. I mean, these, in different contexts, these may be very, very healthy behavior. Well, some of that may be healthy behaviors. I'm not wanting to judge that. I'm just saying that there may be firefighters that want out and they're willing to do anything to get out. Or they may be a more manager type that's going to make, contemplative decision. But the point is that they have different points of view. There's one that really wants to stay in, one that really wants to get out. But then as you work with those and hear those two protective parts talk, often they're both protecting some exiled material that they're trying to prevent from coming forward to overwhelm the system. And so it could be that there's a story of a childhood event that was devastating in some way, that both polarized parts want to try to protect the system from experiencing or re-experiencing that very traumatic childhood event that might have related to an interaction with siblings. It might have been a story of sexual abuse. It might have been a relationship with parents that were either harmful or traumatic, or traumatic in the worst possible way, which is through neglect, where they didn't get the attention that they most needed from their parents. And so those protective parts that come up and create ambivalence are often trying to protect us from some exiled material that also takes the form of a part that can tell its story, that can interact with us, that can relate the story of what happened to them as a child. And as they do that, it becomes possible to have a relationship with material that was previously subconscious, and to reprocess those traumatic memories, and to allow that childlike part to escape from that situation that was so traumatic for it at the time, and then unburden beliefs that were essential for its survival in those moments. And in that way, that part, as it unburdens, can assume its more natural role. And so, I don't know if that was helpful, but we do think, just to summarize, parts get categorized in three different ways. They're either exiles, or they're managers, which is a protective part, or they're firefighters. But parts take on extreme roles when they're burdened, usually by something that was either traumatic or perceived to be traumatic in the past, and that healing is a process of hearing out that dialogue, that inner dialogue, so that we can really develop a relationship with our parts. And what is the we that develops a relationship with the parts? Well, that's self. That's the concept of self-energy, which is, the part of us that is calm and confident and curious. There's 8 C words that, some paradigms call the higher self. In IFS, we just call it the self. And, I think we're beginning to understand how that self is really also a connected self. It's connected to higher orders of social life. it's connected to spiritual life. It's connected to a deep sense of belonging and knowledge. And, if the parts of our system can really see our self energy, then they calm down and they relax and they're able to understand it's going to be okay, and that they can be heard and their story can be told, and it doesn't have to be re-traumatizing.
Mm-hmm.
One way to frame it is the self is the part of us that can see our own trauma without being re-traumatized. Mm-hmm. So it's a place of calm curiosity. And so it's the self to part relationship that we seek to foster in the IFS paradigm. And it's healing on its own. You don't have to solve any problem. There's no right answer to the question, stay in versus get out. It's really a process of having that inner conversation and developing that relationship between self and parts. And then it can become clear whether it's helpful to continue the relationship the way it's been, or whether it needs to change in some way, or whether it may need to end in some circumstances. But that it's from an IFS perspective, the decision that gets made is less important than taking a self-led approach to making the decision.
Really nice summary of the whole model. There's one piece that I wonder if we can just come back to get a little bit more granular on. And it's really, I think, around the development of the parts and how exiled material gets exiled, and why the parts kind of end up taking on these protective parts, why they end up taking on that role and sometimes being burdened by it. Can you speak to that?
Well, I think the concept is that parts are always there. Everyone has parts, and all parts are welcome. And they have some archetypal character. Mm-hmm. You could think of them as archetypes, and in some ways, although everyone's parts may be a little different from each other, there are some similar parts. So they're always there. But they have roles. They help us do things in the world. They help us be in our bodies. They help us live an embodied life. And I think that parts, though, become burdened by trauma. Essentially, something happens to them. And it may be trauma with a big T, that does happen. Adverse childhood experiences are correlated with most health outcomes. In a very powerful series of research studies, people have been able to show that adverse childhood events correlate with diabetes, PTSD, high blood pressure, substance use, all of it. But it could be trauma with a little t, and I've heard it described as the slow drip of childhood, where it's just a friend that didn't want to play that day. For a young person, for a young part, that can be devastating. Like, I wanted to play with my friend today, and he doesn't want to. And why doesn't he want to? And and so some of for we human beings whose social connection is based mostly on our vulnerability, we do get traumatized in these ways. Things don't go the way that our parts want them to go, and they can't. They can't. There's no perfect childhood, and in fact, you could think of it as the perfect child is one where we get challenged sometimes, but there's ways to talk about it afterwards. So I think that, though, that in this conception, a part gets burdened by something that it perceives as traumatic, and that often creates an exiled part that feels some sort of shame or guilt for what happened. In the example I gave of, a friend who didn't want to play with me that day, it's like that part may think, well, I'm not lovable. I'm not, worth playing with, or he'd rather play with our other friend, and because I'm not good enough, and so, the part may take on a whole series of burdens, including, and importantly, shame or guilt or fear or anxiety. And then that often will cause managing parts to come to the fore and say, well, these are very unpleasant feelings. So we're going to push them out of view. And, I'm going to protect, Bob from feeling shame by pushing that part, tearing that shame out of view. And they may even develop a personal relationship with the exiled part that it's exiling, but it says, well, I'll take care of you in your shame so that Bob doesn't have to feel that anymore. And so, that may take the form of, becoming compulsive about, studies, schoolwork. It's getting a little personal. I'm actually telling you about some of my parts. It's like, yeah, well, I'm Dr. Grant partly because I love going to school, and I love going to school because I love learning, but I also, it's a defense mechanism. It's like, yeah, if I'm studying and I'm learning stuff, it means I'm not feeling things that are hard for me to feel. So I learned that really early on. And so I've got that part that says, I got you covered. We're going to do well in school. Doesn't that sound good? Yeah. Okay, let's do well in school. And we don't have to worry about that other one. It's carrying shame because he's out of the picture. I'll take care of it. Don't worry about him. But, the part of me that likes doing well in school is not a very nurturing person, not a very nurturing part for that other one that felt rejected by a friend who wanted to play with someone else. So, it ends up being kind of a fraught system. And, it's helpful when I can come back into the picture and say, I'm so thankful that you helped me do well in school. Look at all that you've done for us. And I think it's important that I take care of the other one that got exiled because, with my self-energy, I can really nourish him and heal him in a way that, is not really in your job description. Your job is to try to do well in school. And, that's not the same skill set as listening to Bob tell his story and the part of Bob that is exiled and tell his story and cry and say how much he really liked his friend, and so that becomes the healing opportunity.
Let's talk about healing. That's where I wanted to go next. You said things like, this part needs to tell their story. And you gave the example earlier about, maybe someone coming to therapy because they feel confused about whether to stay in or leave a relationship. And that the purpose of the therapy is not to arrive at a conclusion, but to create space for these stories to be heard. Can you explain that? It's like, what's healing about having these parts express themselves?
It's what's healing. It's the beginning of the healing process. So I think that what is healing is the self to part relationship, and so that relationship gets built based on the part being able to tell its story without causing a reaction or without having repercussions. So creating a connection between the self and the part by listening to their story is an essential step in the process. building those relationships. And also, the focus also helps. We have in IFS a number of heuristics which are actually helpful. And if I can digress a bit, I think it's clear, and it's clear to, the founder, Dick Schwartz, in his most recent iteration of his book with Martha Sweezy, that IFS could be conceived of as a psychodynamic theory. Mm-hmm. And so it is in this lineage of psychodynamic process. Because it does embrace the multiplicity of the mind, it allows for conflicting psychodynamic relationships within the person. It is a psychodynamic theory. What I like about IFS is that it goes one step in the direction of giving us tools for uncovering exiled or subconscious material. And so, a classically trained psychoanalyst might, expect to spend hours or days or years listening with the client on the couch. And eventually the subconscious material will bubble up, either in terms of dream interpretation or daytime fantasies or behaviors that create ambivalence within them. I mean, they'll just wait for it. And I love that idea of just waiting, witnessing. And so I have great respect for thoroughly trained analysts. And IFS, though, does give us some tools that allow us to move pretty quickly toward uncovering subconscious or exiled material. And so it has a toolbox that allows us to be expeditious in our desire to create inner dialogues. But I don't think the process is very different from what a psychoanalyst would do. It's just a little more guided and a little more intentional. So one of the heuristics that IFS has is called the 6 F's. And so I can walk us through those. You want to find parts. So whatever parts are up, you want to find them. You want to see what's up for the person. It might be a single part that's up that has very strong feelings that need to be heard out. Or there may be a pair of parts, like want to stay in, want to get out. That's a polarized pair of parts. And so you want to find the one or the 2 or 3 that you're going to work with on that day. And then you want to focus on them. Let them know that you're here to listen to them. And when I say you, it's actually the client self is there to listen to them. Now, the therapist's self-energy is also very important in this process. So the therapist self and the client self is there to listen to the parts. And so, it's intuitive that's reassuring. I mean, if you're wanting to make friends with someone, what do? You focus on them. You look at them in the eye and you focus. And then you flesh out. So that's the 3rd F is tell me more about that. Tell me, what that was like for you. Tell me what was the worst part of that or the best part of that. Or what did you do with that? And then we, there's this, I'm not sure. Yeah. The phrase that we use is, how do you feel toward the part? And that's actually a key step because, if you ask me, Bob, how do you feel toward that part that's carrying shame? And if I say something like, well, I actually dislike that part. It's annoying. It bothered me my whole life. Why should I be ashamed just because somebody's trying to play with someone else? That's silly. Those are not self qualities. So that what that tells you when I answer that way is that it's not a self-to-part relationship that's being developed. You're hearing from another part of me that is trying to exile that part carrying the shame. And so you would at that point, having asked me how I feel toward the part, but having not heard from self, you would say, okay, can you give attention to the part that wants to get rid of that shame? And let's find out about it. What is it trying to do? What is it afraid will happen if we hear about the shame? Or what is it what would it rather do if it didn't have to suppress that part that had all the shame all the time? And, and so we changed the focus to the part that came up in reaction to the other part. And we continue to do that. And then we'll ask, well, how do you feel toward that part that wants to get rid of the shame? And, at some point I'll say, well, I'm curious about it. What is it trying to do? And I want to know more. Well, that's self-energy. And so then that's our green light to start doing the real work of developing self-to-part relationships. So the feel toward is one of the 6 F's. And then you want to unblend as much as possible. You want the part to be able to see the self and the self to see the part. And parts don't like doing that. They like being connected to self. They like being connected to self so much that they stick to self. They just stick like a glove. And so one thing that I like to say is that can we ask the part to give us some distance, some spaciousness, so that you can see it better, and so that it can see you better. So, one of the beautiful things about connection, whether it's between people or within our parts, within ourselves, is sometimes the spaciousness actually fosters connection because it allows us to see each other more clearly. And then, that can be healthy in relationships as well. Sometimes that relationship that I started by saying, do I stay in? Do I go out? Maybe there's a middle ground of, let's just take some space, and, we don't spend every day of our lives together, but we take weekends off and have some spaciousness. And that may be all the relationship wants or needs. And it's the same way within parts within ourselves. That sometimes asking them to unblend, they'll say, no, I can't unblend. I'm desperate for more attention. But they say, well, no, it's if you just give us some space, then I can see you better. You can see me better. So there's unblending. And then there's befriending, just continuing to say, it's like, it's so great that I've been trying to protect Bob from feeling shame. He's done such a great job, and look how well he's done in school. And that, has led to a career, and so great. But do you really want to keep doing that all the time? And often they'll say, no, I'm exhausted. I'd rather that Bob, if there were a way for Bob to deal with his shame without me having to work all the time, I'd like that. But I don't think there is a way to do that. That's why I've gotten stuck in this job. So the part may say that. You could say, well, I think there is a way to help Bob with his shame without you having to work all the time. And, sometimes the part will say, I'm not sure that's possible, but I would want that. So, let's give that a try. And then you can ask, that protective part to rest, and it can stay close and watch if it wants, just in case something comes up that makes it afraid. It can step back in if it needs to. But that then gives you an opportunity to go back to that exile, which initially caused the protective part to come up, but that part now is befriended and is willing to rest. And so you can work with the exiled material. And then ultimately you would want to get to a point where whatever caused the burden of shame to come to that exiled part, that part can have a chance to leave that situation and unburden that shame. And then the whole system can appreciate that, yeah, there was a way to deal with the shame that didn't involve having to compulsively work all the time, just as an example.
Mm-hmm.
So the healing process is really one of befriending the parts and hearing them out, and ultimately giving the exiled parts a chance to be retrieved from the hard situation, and then to unburden the beliefs that were important to survive that hard situation. Mm-hmm. And then to have the rest of the parts come back into the situation, see and ask them, did you see what happened there? And some of them will come back in and say, oh yeah, wow, I'm impressed. I didn't think there was a way to solve that problem, but yeah, there was. So, great. And, and some of them may come back and be a little frightened. Like I spent my, the part, like the example I give, might say, I spent my whole life, working obsessively to do well in school. And now what do I do? It's like, I don't know what my job is. And say, well, okay, I'll work with you. There's lots of jobs that you could do. Maybe, you can work on writing a book or something other than school, or maybe oftentimes the job that the protectors want to do has nothing to do with what they've been doing. So the part of me that wanted to do well in school might want to take up finger painting or writing poetry like I was doing in college. Maybe they'll want to go back and do that, or fly a kite. Who knows? But letting them do what they want is an important part of being a good self for them, a good self leader for them. So the healing process is one. I mean, the parts are there. They're still there after the healing process. You're not trying to get rid of any part. You're just trying to allow them to be seen and to play their healthy roles, which are roles that are playful and pleasant and productive to a certain extent. And that's one thing that I like to tell people is we need parts. The self needs parts as much as parts need self. If you think of self, it's this very ethereal quality of almost transcendent. It's calm, courage, confidence, connection, creativity. And so, you could think of it as a brilliant scientist or a brilliant artist or a nourishing parent, just sort of in this beautiful state of being. But self doesn't do certain things. Self does not pick up the phone and call, the teacher at school. Self doesn't go out on a date by itself. Self doesn't have a hard conversation by itself. Self doesn't go to work. And these are all things that we have to do to keep our bodies fed, to live an embodied life. We need parts. But the goal is to have the parts be self-led. So we can be led by these self qualities, but still we need the parts to make decisions ultimately I believe that key decision, stay in or get out, that is self can inform that decision. But ultimately there is going to be a manager that comes in and says, I can see all sides of this now. And a choice needs to be made. We can't be either in or out. And, or there may be, like I said, there may be ways to change the relationship to make it more spacious, but we do have to make choices in life. And I think that those choices are often made by managing parts. And the goal is to have it be a self-led decision. But self needs parts, needs parts to be attentive and skilled. And, we need to study sometimes. We might have to study obsessively, but we need to study sometimes.
And the parts have certain skills and talents, which are important for getting on with life, right?
That's right. They have talents and skills. They have perspectives. They have knowledge. And, I think self probably taps into a very transcendent sort of lineage of knowledge, but sometimes we need to remember where we parked our car. That kind of knowledge that's going to be carried by a part. Yeah.
So Bob, it's interesting. Just like hearing you go through this kind of this progression as you're talking about the model, and like the last bit there, you're talking more and more as if these parts are people, like, beings, right? I was doing some parts work with a client earlier this week, and he talked about we're anthropomorphizing these parts of psyche or whatever. And I'm just really curious about this. And this is maybe a bit of a throwaway question. I'm just really curious to hear your thoughts on this. So you mentioned earlier that parts have archetypal qualities, right? And I feel like I don't know how much you want to kind of back that up and, bring in your expertise in literature. That's something that makes sense to me, especially because there's clearly recurring patterns, right? You do this work and these patterns do reappear very, very often. So there's an archetypal quality to them, but they also seem to have, the qualities the qualities of organisms, like living beings, somehow instantiated in our psyches or in our minds or in our brains or something. The question is, like, what is the ontological status of these parts? Are they actually living creatures? Are they representations of other people that have been sort of internalized through memory? Is this just a helpful metaphor, like a tool to help us kind of like work through crunchy parts of our lives? Like, how do you think about the ontological status of these parts?
Well, I think they're real. I guess I'll say that.
Yeah.
And I think it's most helpful to stay curious about them. So I love your question because it's a very curious question. What are these parts and what are they there for? And I guess I would just start by saying I think they're real. They seem real when we let them be real, and that. And I think that they precede, our birth in some ways. I think that they're real and they come into being with us, or we participate in their being. So, in terms of
Anthropomorphizing. Sorry, it's a mouthful. Yeah.
It is a mouthful, and for some reason this morning I can't quite get my head around it. But people do think of them as sub-personas, and they sometimes it's helpful to let them take a very visible role as a little person or a big person within us. But sometimes that gets in the way, actually.
Mm-hmm.
And so I think that parts can also appear as objects, or can appear as body parts. And in some ways, that's helpful to think about. That lungs. My day job is actually as a lung medicine doctor, and so I think about the lungs a lot. And I believe that lungs are a part. In the sense that they have a reflection in our mind, and that and there's a part of our mind that is very attentive to keeping track of our lungs, what they're feeling, whether they're inflated or deflated, and whether the process of breathing in and breathing out has gone easily, or whether there's some inhibition that potentially could be life-threatening, or be a sign that we're experiencing something important in our lives. Take a deep breath in when we're inspired by something, and then we sigh when we're kind of tired. And so we have our mind and our lungs are very much connected to each other in a way that I think is a self to part relationship on a good day, when we're mindful of our breathing. It's a self to part relationship. And so the lungs, you could think of lungs as a part, liver's a part. I'm studying massage lately because I want to bring body work into my practice. And so every muscle is a part that, and I think we naturally anthropomorphize body parts, and it's helpful in, as I'm learning massage therapy to realize, my bicep is really angry at me right now because it's sore. I insisted on an hour at the gym when I was really only ready for half an hour. So now, that muscle is pissed. It's like, okay, how am I going to take care of it? How am I going to convince it that I helpful to anthropomorphize body parts sometimes, to develop, so that we can develop a relationship. We have such a powerful capacity for connection, social connection, that using that capacity for connection with our body parts is sometimes helpful, and just as it is with other parts of our mind. But I think it's important to not insist that our parts take the form of persons, of little persons, and especially for those of us who are using psychedelic medicine to facilitate the healing process. It's been my experience with ketamine in my ketamine-assisted psychotherapy practice in San Francisco, called the Healing Realm Psychotherapy, that oftentimes parts during or just after a ketamine peak will present as objects. And I remember one situation where his whole ketamine journey was all about harp strings and harps, and harp is this beautiful sonorous instrument, but his harp strings were getting blocked somewhere. There was little blockages along there, and I was thinking, what am I going to do with this symbol? As a, it's like, because IFS is my passion, so I wanted to turn it into an IFS session, but he wasn't coming up with any childhood memories, just harp strings. Finally, I said, what does that harp string need you to know? And all of a sudden, the harp string started talking. It started talking about how much it enjoyed resonating with its neighbor harp string, but then there was one that just was out of tune, and it kept annoying it, and it was a little like his older brother, but and so essentially it turns out that he was having a conversation with parts of himself that appeared as harp strings, and that and then a conversation could flourish, and we didn't have to turn them into little people. They could continue to be harp strings. And he eventually found a blockage, a burden in IFS terms, that had stuck to one of the harp strings and had drawn it out of tune. And so that harp string was able to let go of that blockage and harmonize better with the other harp strings. And so the whole thing was and is that a symbolic? Is it metaphoric, or does he really have harp strings in his mind? I guess I'm not sure I care. I mean, it seems important. It seems real, and I think he felt better after the whole process.
Right. So that question is kind of linked to. Maybe, I don't know, like a more serious one or a more academic one or something, or a clinical one. Just a quick kind of tangent to introduce it. The clinic that I work at, a lot of the team, the clinicians on this team have a mindfulness background. And for many of us, our introduction to IFS was Dick Schwartz's audiobook, Greater Than the Sum of Our Parts. I'm not sure if you're familiar with it, but it's a beautiful kind of marriage or integration of, contemplative Buddhist practice and IFS work. And listened to the audiobook, did these IFS meditations, which I found incredibly helpful and incredibly, supportive way to learn the IFS model. And it was, I guess, quite inspiring as a kind of like a new avenue for practicing therapy with my clients. And it also, at the same time, like for myself and my colleagues here, raised this dilemma or this interesting question about these different models, where, as I'm sure in a mindfulness approach, the idea is to just not get too wrapped up in narrative or too wrapped up in kind of symbols, that are expressing certain internal dynamics. Certainly not to get too wrapped up in our sense of self or our ego, that in certain ways these experiences are illusory or empty, And it really is, the practice of mindfulness is really about being able to sit and observe without engaging with or identifying with these aspects of our experience. And in some ways, IFS is kind of like the complete opposite. It's just like everything has a perspective, everything has a story to tell. And we really need to listen and develop this kind of curiosity and this compassionate relationship. Maybe I'm exaggerating saying everything has a perspective or whatever, but certainly there seems to be a bit of a conflict for me in terms of like, okay, so there are these parts. How real are they? How much do I engage with them? How helpful is it from a healing perspective to granted some kind of agency as having a story and having a need, having to say something, versus noticing all these things and cultivating a sense of equanimity, like that's there and that's welcome and that's okay, but just letting it all sort of pass through consciousness as just different expressions of our psyche without needing to get too involved. So I'm just really curious how you see that.
Yeah, thank you. That's a really interesting question and a good question. I feel called to really talk about unblending as an important part of what I understand to be mindfulness, as well as the internal family systems process. It's really one of being aware of of different parts, if you will, or of different parts of the body, different things in our environment, being aware of them, but not being invested in or not being blended with them. So in IFS, we call it unblending. But I believe in mindfulness, it would be called a state of calmness or equanimity, of just letting things be. And that's so getting back to asking the part to give us some space so that we can see it better and so that it can see us. That's unblending. That's what unblending is, and I think that's what a mindfulness process also desires. Is really a state of being unblended from the material world and unblended from parts. But that isn't the same as ignoring them.
Right.
In the mindfulness practice that I'm imagining, I'm not claiming to be an expert in mindfulness process, but I do meditate some, and I do find IFS to be meditative. And the goal, as I understand it, is not to become blind to what's happening within ourselves or the world, but quite the opposite, to be aware of it all, but to unblend from it, allow it to be something different from what we are as a self energy or in our core of consciousness. And then, how much to listen.
Yes.
I think that's part of the awareness. Listen, notice different parts of the story. Notice what it looks like. Notice, and you don't want to be invested in it. You don't want to, but you want to be aware if that part is feeling shame or fear or anxiety. I think it wants us to be aware of that, but it doesn't want or need us to feel it like they feel it. In fact, they want to know that we have the confidence and clarity to see what's happening to them and have compassion for it without taking it on ourselves. We don't have to feel it ourselves. But I think that a goal is to see it, to be aware of it.
Yeah, I actually agree that obviously awareness, is one of the key skills that we're cultivating with meditation. I guess the trickier bit is around what I might call like reifying. Like you said, these parts are real, right? And And, a meditator will say, well, if you really examine the ego, or like, there's no real center to experience. It's just passing content or something. And that really helps cultivate a sense of equanimity and non-attachment. And of course, none of us are yogis living in the Himalayas dedicating our life to non-attachment. We're householders, and we have our lives, and we have our attachments, and we have our traumas, and we have our needs. And so awareness of these needs and developing discernment and skillfulness around addressing the needs and finding ways to satisfy them and sort of move on and stuff. And it strikes me that attributing like an agenda or a story or a perspective to a part is a tool. It's like a skillful means to work compassionately with some material that is causing some degree of suffering. And so I don't know if that's a helpful kind of bridge between these two things, but I do think because compassion and equanimity are both necessary on a kind of meditative path. But there is something that I get kind of like caught up in this, in the sense of like parts are real, just like, a muscle or a lung, that they have some kind of ontological status that we need to kind of endorse or buy into, as opposed to just being metaphors or just a kind of a process or a configuration of mental stuff that kind of comes and goes or something. So I don't know if there's more to speak to there, but that really strikes me as maybe actually a more subtle difference between these two models.
Yeah. I'll think about that. I could see your point. You don't want to reify something in a given form that, may have been important in the past, but may not be important right now, or may not be part of the, one thing that I feel like saying is that I do believe parts are real, but they take different shapes and forms. Typically, often after they've unburdened, they'll a very small part, or a part that looked very small when it was carrying its burden, suddenly might balloon out into something that's bigger. And a part that was sort of crunched up and like this might become a dancer that sort of moves around the room. And so we don't want to think of parts as being, concretely or materialistically real in a way that makes them immutable, because I do perceive them as being able to transmute and transform and take on different characteristics. Part of the healing process is to unburden burdens that used to be important for survival in this traumatic time that the part may still want to live in, or still has been living in, whether they wanted to or not. But as they unburden, we ask them to bring in qualities that they've wanted. And often they'll bring in qualities of creativity or curiosity, self characteristics. And as they do that, they change. They appear differently. And certainly from one IFS session to another, we want to check in on the person's process. But we don't want to ask that the parts that manifested in a certain way reappear. If they need to reappear because there's more to the story that needs our awareness, then they can. But we don't want to say, that overworking part, is it, how's it doing? Because, it may not be an overworking part anymore. It may be a finger painting part, and it, may have taken on different activities, different characteristics, different qualities. And that's in fact part of the transient process. So I guess, to kind of circle back, I don't think in the IFS community, we want people to get stuck on a certain manifestation of a part. and that may be where the body organ metaphor sort of breaks down, but body organs change too, by the way. Lungs change with age, and muscles get bigger and smaller, weaker
and more
stronger,
sore. Yeah.
And more sore, more or less inflamed. So muscles and muscles, by the way, can change very quickly if they're touched. And so you touch a muscle in a certain way, and suddenly it can relax and become much different kind of thing. But it's still attached in its old places. We're not reattaching anything. But so but this is an interesting conversation. I think though that we just want to say that these mental manifestations, whether you want to call them a metaphor or a symbol, they deserve our attention and our awareness. And now you got me thinking about, ontological origins of this, and are they archetypes?
Yes.
People have often similar parts, but they're never the same.
Sure.
So it's good to be curious about them.
Sure, but I mean that's true of archetypes too. They have a kind of a basic grammar, but their expression is kind of infinitely variable, which is why it's I think a nice way to think about it. But what's the ontological status of archetypes, Bob? Can you help us with that?
I don't know. I think you're above my pay grade right now. But I'll ask. I'll see if somebody wants to.
We'll have you back for round 2 and really get into that question. If you're okay with it, I've got 2 more questions. I don't know how we're doing on time. One thing I've noticed for myself in doing my own IFS process and working with clients is like, it could be a little destabilizing to go from, walking around in the world thinking of ourselves as like a single ego or a single mind, and then seeing the multiplicitous nature of the mind. And all of a sudden it's like, I don't really know where to stand. It's like, am I this part? Am I that part? Where is self even here? Do I even know self? And like, I feel like that it can be a kind of a breakdown of a certain way of making meaning out of experience, ultimately for the best, but how do you work with that phenomenon, that it could be maybe initially destabilizing and that there's all these different perspectives and it's hard to sort of know how you're showing up, and that when you're out with other people aren't seeing parts, they're seeing one body and assuming there's one mind operating inside the body. So yeah, just your thoughts on that.
Well, so I get it. I get that embracing the multiplicity of the mind does create opportunities. It can also create, a sense of insecurity among some of our parts or all of our parts. And I think as you've been doing all day, you raise interesting questions that have facets. So I'll try to stay focused here. A technique that we have in IFS that is important not to skip is at the end of every session where we've asked managers to step aside and rest, that we bring them back in and we embrace them. And so we want people to not be entirely in self when they leave. They need their managing parts to
find their car,
find their way home. Yeah. And so we it's part of the training to actually at the end of every session to ask that all of the parts, the protective parts that have stepped aside and rested, for them to come back in and to give their perspectives and to, explain any concerns. And that's to allow the protectors to have some confidence that the exiled material can be worked with and can be understood and embraced without them having to do whatever they learned to do to keep it out of mind. But it's also to allow that person to come back into their into the sort of managing aspects of their ego. Their managers are necessary.
Mm-hmm.
And one that, for example, that I often end up having to ask to step aside after befriending it and plotting it is the timekeeping part.
Mm-hmm.
So oftentimes when IFS goes deep, people do lose track of time
mm-hmm.
because we've worked with the timekeeping part. We've asked it to give us some space so that we can work with deeper material. And so people may lose track of time. They may have no idea what time it is or how old they are. And imagine just saying, okay, well, 50 minutes is up. Send you home. See you next week. And they're not able to keep track of time, or that part is gone to sleep somewhere. I mean, that could be devastating. Who knows where they're going to end up? So you want the timekeeping part to come back in. You want to tell them what time it is if they don't know, and that's part of coming back into their management system that allows them to be in the world. Now, why do we need a why do we need our managers? Well, to keep ourselves fed. But that's a basal thing. We need managers to uphold our social contract. And, I think Alan Watts has written and spoken brilliantly about this, that, we are social beings, and part of, being a social being is to have some consistency from day to day on who we are. Our friends, our lovers, our parents, our children all look to us to be something like what we were yesterday. and
yeah.
And that's part of being a good friend or being a parent or being a good lover. I mean, it's to be something like what we were yesterday. And yet, we're not required to be exactly what we were yesterday. I mean, I think we aspire to evolve and to change over time. And if we do need to make a major change in who we present ourselves to be in the world, I hope that we can find a self-led way to do that, where we can sit down with the people that, want us to be a little like we were yesterday and say, look, I don't need to do that anymore, and I don't want to do that. So I am going to quit my job or do whatever I need to do to change, and just at least give them the heads up so that they don't have parts that say, he quit his job because he doesn't think supporting me is worthwhile anymore, and that may not be the point. And I hope it isn't the point, but I think communicating the changes that we need to make is going to ease the transition. But let's face it, that a lot of the reasons we need to be consistent from day to day, or at least a little consistent, is to maintain our social contracts, which are so important for us. And yet they're not everything.
Right.
Inner peace and fulfilling life is also important, but part of that is being a little consistent. And so who does that for us? Our managers do that. And so our managers are our friends. They keep us in good relationship, and they keep us employed. They keep us sane, actually. And just understanding that if we open ourselves to all of this, if to use mindfulness metaphors, if we genuinely get to a place of awareness of all things and all people and their constant mutation, it becomes difficult to do anything other than meditate in that state. And yet, meditation for most of us doesn't feed the children,
Right. Right.
So I think we need the managers, and that's a good example of how we need them. And they should be invited back after every IFS session. And, thinking about psychedelics, that's also really important. We don't, give people a psychedelic medicine, let them go into this sometimes beautiful dreamlike state where everything is possible, and they can become awareness of so much more than an ordinary state of consciousness might allow. We don't let them try to walk home in that state. They have to. We want them to come back and be back in their ego functions, which may have transformed through that process, just as they can transform in an IFS process. But we need the managers. to get home, to find our car, all of that.
Yeah. So I do want to talk about psychedelics briefly here, and I'm gonna try to sneak in two questions into one, if you don't mind.
You're good at that.
Yeah, maybe it's not such a great skill as an interviewer, but IFS has become so popular in the therapist community, and right, it's impossible to get into even the level 1 training, and the IFS Institute is overwhelmed by demand. I'm curious what you think of that. And then relatedly, like it seems to be happening in parallel with, the psychedelic renaissance and the kind of arrival of psychedelic assisted therapies. So I wonder, what is it about IFS that plays so nicely with psychedelics? Maybe those are two separate questions, or maybe they're related. I'll let you figure that out.
I think we are in we're in an era of expanding consciousness.
Yes,
and so I think that's really how psychedelic medicine is seeming more fruitful and more helpful, and it's also why IFS is coming to the fore. Both of these are very expansive opportunities, and I think we're in a period of expansion. As a caveat, I don't think our goal is an infinitely expanding consciousness. I think we want our consciousness to breathe, and inspiration is important, but expiration is also important.
Yeah.
And in fact, expiration makes inspiration possible. We breathe in, we breathe out. And so we expand and contract, And so I don't think we should I think we should enjoy this period of expansion. I think we'll have an opportunity to enjoy a period of contraction at some point. And I just would hope that it not be brutal the way it was in the 70s with the war on drugs, which wasn't really a war on drugs at all. It was a war on people who were, And so I think that IFS plays well with psychedelics because they both, psychedelics and IFS, embrace the multiplicity of the mind. I think that IFS it seeks consent at every step. A good IFS therapist will stop frequently and say, is it okay that we talk about that? Is it okay that we look at that part that may have been exiled? Is it okay if we focus on this other thing? And if the client says no, it doesn't feel okay, then it's no. We don't try to talk them into doing something that we think is good for our clients. That's not what IFS does. It seeks consent at every step. And I think that that's a good skill to have for people holding space with psychedelics, because we don't really know what their state of mind is at any given moment, and they may they may have something going on, and it may look to us like one thing, but we want to check in with them and say, is it okay that we work with that, or we talk about that? And if they have a part that comes up and says, no, I'm really afraid of that, and I want to leave it alone, and we just I think as we hold space in the psychedelic world, we want to make sure that we're seeking consent at every step along the way, because the person's changing. They're experiencing different aspects of themselves. So both IFS and psychedelic guiding require that it be a continually consent-seeking process. I think that psychedelic literally means mind manifesting.
Mm-hmm.
The roots of the word mean mind manifesting, and IFS is mind manifesting. We're discovering parts of the mind that may have obscure relationships with ourselves, and some of it may be exiled. It may be subconsciously exiled, and so both are mind manifesting. I also think that IFS opportunes psychedelic states. It is itself a psychedelic process, and I think first, once we sometimes there's a whole series of protectors that we have to ask or that we end up asking to rest. And sometimes they're willing because they trust us. And it's been my sense that if there's a kind of a logic making part and that one rests, if there's a timekeeping part and that one rests, and there's a kind of a part that needs everything to have material form, if that one rests, people will start to hallucinate in a way that they also do with psychedelics. They'll imagine things. It's like dreaming while awake. They'll see symbols or people, maybe ancestral spirits. Maybe it'll be a very rich, dreamlike state that when it happens when people are awake, we call it hallucinations. But it's not pathological because we've kind of opened up a space in which people can dream while awake. And so that so IFS is psychedelic in and of itself, and it's not uncommon for another client lamented that she had no spiritual life, she had no spiritual beliefs, she didn't believe in the afterlife, any sort of spirituality. And during a preparatory IFS session, she eventually went on to get some ketamine. She had a very rich conversation with her mother and father who had passed away 10 years before. And, this is someone who, had a part that wanted to assure me that she had no spiritual life. And yet she had a very rich conversation with, and you could call it projections of her memories of her parents or their actual spirits. Again, I'm not sure of the ontology and I'm not sure I care. It felt very real at the time. Yeah. And she was able to talk to them. She was able to say some things to her mother and father, who had, again, died 10 years before, that needed to be said. It's just things that needed to be said. And that was healing in many respects on its own. And so that was you could call it a hallucination. She hallucinated the spirits of her father and mother. With IFS, there was no medicine involved at that point. So IFS is psychedelic in its own right. And it does it by just asking the filtering parts of our brain to rest for a moment. And what happens is we dream while awake. And that can be a healing process in the same ways that dreams are healing, I believe, or can be at least healing. So I think IFS and psychedelics do play well together. I think the marriage of those two, I think, was pioneered by Michael and Annie Mithofer, who are both properly trained IFS therapists, as well as leading the clinical development of MDMA for treatment of PTSD. And it was actually through Michael Mithofer that I learned about IFS for the first time. When he first described IFS, I was in an MDMA training, and he told me about it. It's like, oh my God, that makes total sense to me. Throughout my life, I realized that I was passionately ambivalent about everything. And I have friends who say, well, you're just apathetic. You don't really care. I say, no, I care. I care about this and that, both at the same time. So, so I realized that I had parts as soon as I heard about the IFS model. And the more I learned about it, the more I realized that the power of MDMA is really in allowing us to come into self-energy so that we can see our parts more clearly, become aware of them more clearly, and not be blended or invested in them. We can let them have their stories, be aware of their stories without being re-traumatized by them. And that's, I think, how MDMA works, is through essentially facilitating an IFS-like process that might not otherwise be possible in someone who is so easily triggered by intrusive thoughts or memories or arousals and negative content and all of that stuff that comes with PTSD.
Very interesting. I could keep going for another 2 hours at least. But I think we've taken enough of your time this morning. Thank you so much, Bob, for this really stimulating chat.
Yeah, well, thank you, Joe, for asking really good questions. I'm going to be pondering them, and thank you for hosting this educational program, which I think is so interesting and useful for so many people. And the work that you're doing clinically is also amazing, and I'm grateful for the patients that we've shared over the last year.
Mm-hmm.
So, yeah, and look forward to seeing what happens next. I think it's going to be great.
Absolutely. Totally agree. Do you want to say anything about Healing Realms or about how people can find you online if you want them to find you online?
No, we're open, and we specialize in ketamine-assisted internal family systems. And we're based in San Francisco, California. And our website is healingrealmcenter.com. And there's a link there for a free consultation. And then people travel from all over the world to work with us. We're licensed in California. So, but if you're in California, as far as I'm concerned, you're Californian for that day. It's not just me doing the work. We have an extraordinarily diverse and queer group of therapists and psychiatric nurse practitioner myself. I'm not a psychiatrist, although I think it's a missed calling. I would become a psychiatrist if and in fact I may. I keep thinking I should just apply and be a psychiatric resident for a while and then be a psychiatrist, because I honor that discipline so much. But I'm not a psychiatrist, but I do have a psychiatric nurse practitioner, and we have a whole group of psychotherapists who are brilliant, and they're all getting IFS trained on the job, and then we're hoping to open up new training programs for people. I do teach ketamine-assisted psychotherapy from an IFS lens. That's an online course that cycles every couple of months. And then I teach a basic ketamine-assisted psychotherapy class, which doesn't really get too deeply into IFS, but teaches the basics around route of administration and dosing and, side effects and indications, contraindications, all that stuff. That's in the basic CAP class. And then the advanced class is really all about IFS and ketamine together. So, I really want to support the IFS community. I think that IFS and ketamine and MDMA are particularly good matches, and I just am an advocate for more people getting trained and learning how to do this.
Mm. Having followed one of your trainings, I can testify to the quality of the training and how helpful it was to me. So I'll put that endorsement out there. And again, Bob, thanks so much, and hope to chat again sometime soon.
Yeah, we will, Joe.
All
Good
right.
to see you.
All right. Take care, Bob. Thanks for watching this episode of the Mindspace podcast. To get more episodes, you can subscribe on this channel or go to your favorite podcast platform. Thanks, and be well.